Down syndrome is a condition also known as trisomy 21, in which a baby inherits more genetic material which causes him to delay while growing both mentally and physically. This disease is normally discovered during the process of pregnancy, otherwise, it will be discovered through labor. Each kid develops this condition in its own way. Some need lots of medical treatment and help, while others can live a healthy life. Normally, babies inherit a total of 46 chromosomes, 23 from the mother and 23 from the father. In this case, the child gets one extra chromosome, giving the child a total of 47 rather than 46 chromosomes. Down syndrome happens when a kid has an extra copy of chromosome 21. That's why the condition is also known as trisomy 21. Having extra genetic material alters the process of development and causes all the characteristics associated with Down syndrome. Scientists know what Down syndrome is, but they are not sure why it happens. There is not a single way to prevent the error occurred in the extra chromosome. This disease affects boys and girls equally. There is still the same chance to have one extra chromosome and have the disease. This can happen to people of all races and economic levels. It's something that happens incorrectly during the formation of babies, but there is nothing to do about it. The National Down Syndrome Society says 1 in every 691 babies in the United States is born with Down syndrome, making this disease the most common genetic condition. Approximately 400,000 Americans have Down syndrome, and about 6,000 babies with Down syndrome are born in the United States each year. In most cases, Down syndrome is not inherited because it occurs randomly in the reproduction of cells in a parent. The disease normally happens in sperm cells. As a result, the cell has 3 copies of chromosome 21 instead of 2 copies. Both women and men with Down syndrome can be fertile, however, they are always advised not to have kids because of the hard work involved. If one of the parents has the disease, there is a 30 to 50% the kid will have it. And if both parents have it, then the chances of having a baby with Down syndrome increases. Trisomy 21 happens due to the mutations in only one gene. Because this occurs randomly, it can happen either in autosomal dominant, autosomal recessive, X-linked, or Y-X-linked. There is no treatment that can cure this disease, but there is always some kind of treatment, such as medical checkups and finding support. Special education, how to support independence, diet, and exercises are also some sort of treatments that are key factors for kids with Down syndrome. In most cases, kids with Down syndrome tend to have similar physical features like flat facial profile, upward slanted eyes, small ears, and protruding tongue. They tend to grow at a slower pace and remain slower than their peers. Some might have digestive issues, problems with speech that sometimes become very severe, becoming very hard to understand them. Some kids with Down syndrome have serious cell problems, while others can have pulmonary hypertension, hearing and vision problems, stomach problems, seizures, obesity, and a higher chance of infections and a risk of a childhood having leukemia. Down syndrome is a disease that can affect both the family and the kid. It's a disease that needs lots of love and patience. While some families can handle taking care of a kid for the rest of their lives and give their babies to adoption or have miscarriages, other families who do have kids with this disease or adopt them are admirable. This disease requires all the attention possible, so parents who take care of these kids should be rewarded for the awesome job they are doing.